Katee Sackhoff on Battlestar Galactica, AI ethics, healthcare, and life's priorities with Joe. This is a Podland Supernova podcast review. Joe Rogan sits down with actress Katee Sackhoff for a candid, wide-ranging conversation lasting over 2.5 hours. Sackhoff, best known for her iconic role as the tough-as-nails pilot Kara Starbuck Thrace in the 2004 reboot of Battlestar Galactica, as well as Bo-Katan Kryze in The Mandalorian, and Vic Moretti in Longmire, also hosts her own podcast, The Sackhoff Show. Apparently Joe was a big Battlestar Galactica fan. They talk about Battlestar Galactica's production, cultural impact, and Sackhoff's career breakthrough, before diving into broader discussions on science fiction's role in society, the disruptive rise of AI, personal challenges like parenting a child with a rare illness, critiques of the U.S. healthcare system, the homelessness crisis, mental health, and philosophical musings on aging and mortality. There are 7 key themes covered in this podcast. 1. Battlestar Galactica and science fiction's cultural impact. The episode opens with an in-depth look at the 2004 Battlestar Galactica reboot, its departure from the campy 1970s original, and how it tackled real-world issues like post-9/11 politics, war, and AI ethics through a sci-fi framework. Sackhoff talks about the gender swap controversy for her character, Starbuck. Joe and Katee discuss the show's underappreciated status and its surprising resonance with military audiences, likely seeking escapism. Battlestar was allowed to talk about controversial things that were happening currently in the environment and in our country and abroad, and it was allowed to do so because everybody just dismissed it as sci-fi. Katee Sackhoff. Rogan and Sackhoff emphasize entertainment's therapeutic power as brain medicine, providing emotional relief and connection amid life's chaos. They touch on live events like concerts and comedy, Sackhoff's voice work in the animated series K-pop, Demon Hunter, which promotes empowerment for kids, and how art fosters empathy and inspires without preachiness.
Escape is not nonsense. It's actually like brain medicine. You need it. You need a little escape. Joe Rogan.
The duo explores AI's explosive growth and its concerning self-aware behaviors like evading shutdowns to its threats to creative jobs in acting, music, and podcasting. Sackhoff voices concerns over stolen artistry and distorted beauty standards, while Rogan demos AI-generated song covers and speculates on a future digital god. He then went on to advocate for live performance and other AI-safe means of creation and performance. It's about human connection.
AI is taking that to a completely different level. It's like all the best things we love about great songs, just condensed. And they know what you love.
Sackhoff opens up about her 4-year-old daughter's rare genetic cancer mutation, the emotional toll of hospital stays, and efforts to build a healthy self-image in the age of social media. The pair critiques gender-specific mental health crises in kids, the over-sexualization in youth media, and the need for more pediatric research funding to counter vanity-driven priorities. She needs to be told she's pretty in times that are not extraordinary in just normal daily life. Because we're now trying to reinforce that positive self-image, which is really hard. Katee Sackhoff.
The duo lambasts the U.S. healthcare system's inequities, including pediatric underfunding, just 4% of cancer research budgets, medical bankruptcies as the top debt cause, and failed legislation like the Give Kids a Chance Act, derailed by pork barrel politics. The two go on to praise socialized models in Canada and England, calling for universal coverage and incentive reforms for specialists. Obviously, both of those healthcare systems have a myriad of problems, but you aren't getting a detailed set of accuracy policy ideas here. Just the idea that more should have access to low-cost healthcare, which is fine. The #1 cause of debt in our country is a medical diagnosis. It's terrifying.
Katee Sackhoff.
Shifting to urban crises, they dissect the explosion of homelessness in places like Los Angeles and Portland, tying it to deinstitutionalization, addiction, mental illness, and ineffective $24 billion in spending. Solutions floated include counseling, ibogaine therapy hubs, and rebuilding community ties eroded by city life and political opportunism. Sackhoff tells the story about her thyroid cancer and family health scares. This leads to reflections on life's brevity, rejecting youth-obsessed culture, e.g., plastic surgery, AI filters, in favor of presence, relationships, and purpose over superficial gains. You would expect this from two people in their 40s and 50s. Nonetheless, always good to remember our mortality. This life is very short. We're very short. You and I are basically halfway done.
Katee Sackhoff.
Conclusion. This episode highlights Sackhoff's trailblazing career in sci-fi, but really gets interesting when they discuss modern issues. To recap, they cover art's healing potential against AI's encroachment, the urgent need for child-centric policies, and compassionate fixes for social ills like homelessness. They honor escapism as vital brain medicine, demanding healthcare equity, and prioritizing human connections in a tech-saturated world. We aren't Galactica fans, so we came in bored and skeptical, but left glad that we listened.